Frontline Friday. I'm here at the offices of Health and Human Services Department, City of Brantford. This is the building at 220 Colburn Street. I'm going inside now to interview one of the employees as to all of the good work that is being done inside 220 Colburn Street. So I'm now inside 220 Colburn Street, and I have with me Christina. Christina works for the city. Christina, just tell us briefly what you do for the city.
Yep. So I'm a service coordinator with the City of Brantford. So in this building, we administer the Ontario Works Assistance Program and just meet with clients to kind of discuss any barriers or issues they're facing.
So that would be someone who's collecting social assistance,
Yep.
Ontario Works. Also, we administer from here our housing program.
Yes.
And all the decisions that are made regarding our shelter system are made here as well.
Yes, exactly.
Okay. So tell me, what has happened since the COVID-19 crisis began? What has happened to this department of the city, which is a critical department to deal with the situation, at least the impacts of what's happening, right?
So since COVID-19, we've definitely seen an increase on, participants being able to pay their rent from being laid off. We've stopped that contact of in-person with clients, so they're not being able to meet with anyone, and then the same thing goes for like the housing department as well.
Right, and that creates a whole set of challenges because in the past it was really based on personal contact and getting to know your clients. So, and we've also had quite a large spike in Ontario Works applications.
Yeah, so we've definitely seen like a great increase in those numbers as well, just over the last couple of weeks with the COVID-19 happening.
Right, and there's a new program the province has announced, sort of an emergency assistance program. And then of course we have all the issues we're dealing with here in terms of our shelter housing for homeless and all the issues we have with that. So how are staff dealing with this increased pressure?
So I think kind of just every day we're really being able to come in and work as a team and then kind of take every new implementation that's going on with COVID-19 and being able to assist anyone in the best way that we can.
Okay. So I'd like to thank Christina and all your colleagues because it's fine people like Christina working for our city, doing all the things that we still must do. We're a very essential service and they're being done. And I got to tell you, I think they've been done in a really great way, very dedicated, committed staff. So Christina, thank you very much for your service to the city. And have a great day.
Thanks, you too.
I'm over at Brant Towers with Marcia, and Marcia's a property manager with our housing department. And Brant Towers is an important part of the housing service we provide to residents, mainly seniors who live here. And these are seniors whose rents are subsidized, either in full or part, and they really probably don't have any other options.
That's correct.
Okay.
Yes.
And so the COVID-19 crisis had a severe impact upon our housing department.
That's correct.
But however, you've risen to the challenge. Why don't you tell us some of the things that staff have done to protect the residents that reside here in Brant Towers, and also Lauren Towers is right behind us.
That's right. Yeah. So we've done a few different things to help kind of ease some of the concerns. We have greeters set up in both buildings. They are rec staff from the city. They're assisting in a few different manners. What they're doing is basically screening all visitors that are coming into the building just to make sure everyone's healthy that's coming in. They're also providing some in-home kind of puzzles and search words for the clients to partake in at this time of being isolated in their units.
Right, fairly stressful. There's a beautiful trail area behind here that the seniors like to use, I'm sure.
Mm-hmm.
So how have they been, our residents here, how have they been dealing with this psychologically?
I think pretty positive. We're really trying to encourage everyone to keep their 6 feet distance. We've had to kind of close a few of our common rooms and those spaces, which definitely makes it difficult. But they do know that housing staff is available, so we're just a phone call away if they have any questions or concerns.
Okay. Well, Marcia, I want to thank you and your colleagues for all the work that you do assisting. And it's not only just seniors, but there are many other people in this community that rely upon the housing services that we provide. And you're one of my heroes.
Oh,
I hope you have a great weekend.
Thank you, Mr.